Now talking about the motor loss due to cubital tunnel syndrome, and we're going to compare here the motor loss in both proximal and distal ulnar nerve injury and the deformities due to both side of injury. So in proximal nerve injury, those 15 muscles, the intrinsic muscles of the palm, they will be paralyzed, including the 1.5 muscles of the front of forearm, that is flexor carpi ulnaris and the medial two tendons of flexor digitorum profundus. These muscles will also be paralyzed in case of cubital tunnel syndrome, and therefore the clawing on the ring and the little finger will be relieved a little bit because of the paralysis of the long tendons reaching to the terminal phalanx of ring and the little finger. For flexion of terminal IP joint, that is flexor digitorum profundus, will be paralyzed. However, flexion at proximal IP joint will be intact in both the conditions. In distal and proximal nerve injuries, your flexion and extension at the proximal IP joint will be intact. The reason is they're being flexed by this muscle flexor digitorum superficialis, which is completely innervated by median nerve. Similarly, both proximal and distal IP joints are being extended by extensor digitorum, and that is being innervated by radial nerve.